Dr. Currie here. Ferritin is an acute phase reactant. And what that means is when the body is in a state of crisis, it can start storing iron in the form of ferritin in the tissues and in the organs. Now, that can be a real bad thing, right? Because iron has the hydroxyl ion, which is the single most potent free radical in the entire human body. And so what free radicals do is they cause damage to tissues and to organs. And so when your body is storing too much iron in the state of crisis, then it could also increase the amount of free radical damage. So there is a genetic condition called hemachromatosis. And what hemachromatosis is when the tissues are storing too much iron on their own, but it may not be because you're inflamed, but guess what? That iron can cause the toxicity because iron is a heavy metal. And so it can have those free radicals that come in that cause all kinds of major problems and actually destroy tissues and organs. So one way to check for hemachromatosis without doing genetic testing is on a blood work to run ferritin and also C-reactive protein. C-reactive protein is another acute phase reactant. So if your ferritin levels go high on blood work and the C-reactive protein goes high, that's a marker of inflammation in the body. But if ferritin goes high without elevated levels of C-reactive protein or CRP, then that's an indication that that could be hemachromatosis. And so hemachromatosis is seen mostly in males who are over 40 years old, usually of white or European, Caucasian descent, and it can be a real problem. And so that's why blindly taking iron is not necessarily the thing that you want to do if you don't know your iron levels, because you don't want to have too little of iron because that's anemia, iron deficiency anemia, but you don't want to have so much iron that your body is storing that iron in the form of ferritin and then therefore making you ill.